is a non-invasive treatment modality. So here is a slide, shows how it works. This is a transducer. The ultrasound beams were generated from this surface of this transducer and just focused at a very tiny point. During the treatment, the ultrasound beams penetrate the human body and just focused at the target tumor. When the temperature increased to over 65 degrees, necrosis occurred. From the monitoring image, monitor ultrasound, we can see the grayscale changes like this. So when we see the grayscale changes like this, it means the water is boiling. It means the tumor the necrosis is occurred. So now I can show you how did we do the treatment. For example, this is the liver. So first we start from here and we solicate. Then we can see the grayscale changes like this. Then we move the focus to the another point, just like here. Then we solicate again. Then we see the grayscale changes. Then we move down to this point and solicate like this. So when we see the grayscale changes, area cover the whole tumor, then the treatment is completed. So it's very simple. So this is how did we do. So first I want to talk about the HIFU treatment for liver cancer. As we know that we have so many ways can be used to treat the liver cancer. HIFU, of course, is one of these modalities. So in 2013, the FAST Foundation organized a group meeting in Heidelberg, Germany. In this meeting, we reached a technical and clinical consensus. In this review, we can say we all agree with that. So far, the ultrasound-guided HIFU, the GSM model, remains the only system can be used to treat the liver cancer. So for the liver cancer, HIFU can be used for not only for palliative treatment purpose, also can be used for the curative treatment purpose. So first, I show you the HIFU treatment for small HCC. So in China, of course, for small HCC, the treatment of choice is surgery. So only when the patients were not indicated for surgery or they are not indicated for RFA or they don't want to go for this kind of treatment, then they come to us for HIFU treatment. So for the small HCC, in this study, we just like if the solitary tumor should be smaller than 5 centimeters in diameter, or if the number should be less than 3, with each tumor smaller than 3 centimeters in diameter. So this is a study at the beginning we did. So total 35 cases, and here is the baseline characteristics of these patients. So we can say most of them had just one lesion, and so most of them at a stage 2. So after HIFU treatment, we follow up these patients. The 5-year survival is around 17%, which is very good. So here we can say how the procedure. So this is the lesion, just 4 centimeters in diameter. So we start to treat this lesion. Also from the ultrasound, we can see this patient had ascites and the cirrhosis is severe. So no chance for surgery. So we treat this case from 2 p.m. Then you can see the grayscale changes like this. Totally 30 minutes, we finished this treatment, and we can see the grayscale changed area was larger than the tumor size. So, which is very good because for the curative treatment purpose. So generally, the treatment, the room time for the small HCC is around 2 hours. So this most important for this kind of case, like the lesions located in difficult locations, like HIFU can be used for the palliative treatment, also for curative treatment purpose. So now I'm going to show you for the small HCC. Can you? Yeah. So in China, like you already knew about that. So for the small HCC, the treatment of choice always go to surgery. So in our center, like if the patient come to me with a small HCC, they are not indicated for surgery, or they are not, they don't want to have go to surgery, or they are not indicated for RFA, or they don't want to go to for RFA. So in this study, like we enrolled 35 patients, like this is the baseline characteristics, like you can see all these patients, like the size, the average size is around 4 centimeters, and most of them at the stage 2. So we performed the HIFU treatment. The follow-up results shows a 5-year survival rate is around 70%. So like this is comparable with the treatment like the surgery results. So for the treatment, it's very simple. Like this case, this patient had a cirrhosis, and also from the ultrasound, we can see still some ascites there. Here is this lesion is around 4 centimeters in diameter. So we treat this one at the 2 p.m. Then totally 35 minutes, and you can see the grayscale change the area to cover the whole tumor. The treatment area was larger than the tumor size, so for the curative treatment purpose. So like this one, the lesion is located in difficult locations. The patient had RFA before, but only ablated small part of the lesion. So the patient came to our center, then we treated this patient with HIFU. So this is contrast ultrasound shows the lung perfusion area. So 1 day after that, the CT scan showed the treated area. There was low, the tumor was completely ablated. Here is 1 month, and this is 3 months after that, the tumor was getting smaller, no recurrence, and low residual tumor in there. So this is an old case. Probably you already saw this before. This patient had the surgery, had a surgical resection for HCC before, but later there was a new lesion there. So the patient didn't want to go to the surgery, so came to our center. Then we treat this patient. MRI shows 3 months after that, the treated region was much smaller than before, and you can see there was low enhancement. We could still see the surgical scar there, but the tumor was getting smaller. 19 months after that, there was low lesion, disappeared after that. The 2 years after that, no recurrence. Then this means still, like I said, curate treatment purpose. So let's go to the other one. And so, like we knew that both of the patients with the diagnosis was made, they were at advanced stage. So for this patient, this kind of patients, so usually we refer them to go to TAE for transcatheter arterial embolization first. But unfortunately, around 17 to 18% of the patients after TACE, they still have the residual tumor there. So just like this case, we can say this patient had a TAE first, but we saw the enhancement in the tumor. So only part of the lesion necrosis there. So for this one, we should go to perform HIFU treatment for this kind of case. So you can compare. That's completely different. So that's what we do. So after TACE, if the patient, the lesion was unblessed, then we just leave it alone. If we found some residual tumor, then we go to have HIFU treatment. So we compare two groups of these patients. So you can see from next slide, then this is the baseline characteristics before treatment. So you can see low significant difference between the two groups. So after treatment, we follow up the patient at different. Next, Jenny. And you can see the survival rate at different follow-up time. After case, we gave the HIFU treatment, the survival rate was much higher than those group just treated with TAE alone. So I think this is very good opportunity for the patients if they don't have other choice. Next. So this is a case like we treated a long time ago. This patient's lesion was 14 centimeters in diameter. So this patient had diabetes and hypertension. She didn't have the chance. She was not indicated for surgery. Then this patient went to have the TAE first. Then we treated this patient with HIFU. So you can see the follow-up image. So different time, 4 years later, you can see the treated region was much smaller. There was low recurrence. So the patient still alive. So for this kind of patients, HIFU offer them another option. So except HCC, for liver metastasis, HIFU actually is more sensitive. It's easier to treat liver metastasis than HCC. So here, I just want to show you 82 cases, like the tumor number enrolled in this study, like the number should be less than 3. So in this, among the 82 patients, 28 patients had 1 lesion, 15 patients had 2, and 39 patients had 3. So the average size was 6 centimeters in diameter. So all of these patients not indicated for surgery, not indicated for RFA, or they don't want to have this kind of treatment. So they came to us, we treat with HIFU. So among them, 22 of the 82 patients had previous surgery, and 30 had case before HIFU treatment. Or the total number of the lesions we treated 175, but around 19% of the lesions had been completely ablated, and 18 of the lesions had a partially ablation. So about the edema and about the complication, we don't have major complications in these patients. Only 16 patients had local edema. So all of these patients had image evaluation after HIFU treatment, CT, MRI, or PET, or ultrasound. So for the overall response rate was very good. So here is just some examples, some cases like this case, this lesion, this patient had colon cancer and had liver metastasis located adjacent to the IVC. Here's the portal vein. So we no other choice. So we treated this case. We just put the focus right there. You can see the grayscale changes. It's very easy. So just we recorded the grayscale changes area. So after that, here's before the PET scan shows the lesion right there. So 3 weeks later, the PET scan shows the tumor was the lesion was completely ablated. So the total solidification time just 13 minutes. So which is very good, very sensitive. Next. So here is another case like this patient also had a colon cancer. Then the lesion, liver metastasis just located segment 1. So we knew that there was no other choice. So we treat this with HIFU. So the total solidification time was 33 minutes. So 1 day after that, the CT scan shows this is a treated region, no enhancement in this area, no perfusion. So the treated area was much larger than the tumor size because for the curative treatment purpose. So the good thing you can see the IVC, the portal vein, so low damage. Here 31 months after that, you can see the treated region, the tumor was getting smaller, and we consider the perfusion of the major blood vessels. And here 3 months and 8 months, 2 years and 3 years. So almost disappeared after 3 years. So except for primary liver cancer and liver metastasis, and we also use this for the cholangiocarcinoma for those who are no chance for surgery, or they are not indicated, or they are not no response to chemo. So we can use this one to treat HIFU, to treat this kind of patients for palliative treatment purpose. And since the cholangiocarcinoma, the blood supply is poor in both of the lesions, so also it's very sensitive. So next. So we can say, like this case, this patient was very young, just 37 years old. In 2014, he was diagnosed with cholangiocarcinoma. The C19 line was very high, and he was giving chemotherapy. The tumor marker decreased, but 3 years later, the tumor marker increased again and low response to chemo. So we decided to treat these patients with HIFU, then give chemo again. So here is the lesion. We can see multiple lesions. This largest one was the size was larger than 10 centimeters. So we treated this case. The treatment time was not so long. So we can see the next slide. Next. So here, like the left lobe of the liver, we can see the grayscale changes area, just like this. Here is stomach. So the total solidification time, just like 1 hour. So, and the power we use 400 watts, the total energy. So the response was very good. So let's see the follow-up image next. So this before, here's after that. So we can see the most of the tumor was ablated, the tumor was treated. So after treatment, the tumor mark decreased again, then we give the chemo. So the patient benefit for this kind of treatment. Next. Here is another case. This patient was 17 years old, diagnosed with cholangiocarcinoma. So you can see the lesion over there is around 7 centimeters in diameter. Here is this before, we can see the perfusion of the lesion. And here's after that. So the total solidification time is 3,000 seconds. So here's 8 months after that was getting smaller. So for these patients, I think HIFU can also help these patients. So for the liver cancer, I can conclude that HIFU can be used for the curative treatment purpose, also palliative treatment purpose. To the patients can benefit from HIFU treatment. So here is about the liver. Now I'm going to share with you guys about the pancreatic cancer, the experience from China. So we started to use HIFU to treat pancreatic cancer in 20 years ago. So at the old days, then we can see like this 25 cases. Next. So at that time, so the effective rate was not as high as right now. Like Holger already showed us, like the pain relief, almost 100%. So at that time, like around 70% like that. Also, MRI shows like the local tumor control was good. So next. So here is about the tumor volume. We had 4 patients had a tumor disappeared, and 8 of them had shrinking, and 10 of them had stable. So local control was good. The effective rate around 90%. For the tumor marker, 92% of the patients had a tumor mark decreased. So which was good, even at the early stage. So now I think it's different. Here is a table I summarized like different center, different country. They use this technique to treat the patients with pancreatic cancer, like from Korea 2004. At that time, after their patients, like the median survival time is around 1 year, like the for stage 3 and for stage 4. The pain relief is 100%. They reported also in Milan, like Franco Ossi from his center is a similar result like the Korea did at that time. Also Bulgaria and also Spain, but now like from Holger from Germany, they had better results now also in China. I think this patient, we have the better results right now. Probably one because of this technique. Another one, also I think they like the chemo. The development of the chemo also helps this kind of patients. So I think in the future, probably we need organize a multiple center studies to compare like the chemo and between chemo and chemo with chemo plus HIFU. So I think this future we should do. So I also just want to show you some cases next. So like this case, this patient had a pancreatic cancer over there. The celiac trunk was surrounded by the tumors, no other choice. So for this one, we treated with HIFU. The solidification time is 21 minutes. So CT scan shows 14 months after that, the treated region was getting smaller. The blood vessels, low damage. I think is very good for this one. So this patient, like after treatment, the pain disappeared. Local control was very good. The patient died 2 years after HIFU treatment. So I believe she benefit from this treatment. So next. Jenny, next. So for the like the pancreatic cancer at the head of the pancreas, we use a like metallic stent. So like Hawker said, plastic stent, but most of our patients use a metallic stent. So because we just don't take the chance, so we usually just like this. But it's okay, either plastic or metallic. But we can, after that, we can treat the patient safely. So here's CT scan shows 1 day after that, the treated region. So then we can see the stent over there, but low damage to the surrounding structures. Here's 3 months after that, we can see the treated region was getting smaller. PET scan shows no recurrence in the treated region. Next. So this case actually we treated last year. This patient was very young, just 44 years old. He had a pancreatic cancer here, but also had a liver metastasis. So for this one, we treat the tumor here. Then we follow up this one. Then you can see 3 months after that, almost was disappeared, was getting smaller. Also next, for the liver metastasis, here's before treatment. You can see multiple lesions over there. Also, we treated this one, and after that, gave chemo. And after that, 3 months after that, also the small lesions was getting smaller. So I think for the pancreatic cancer, a HIFU treatment is really a good choice for them. So according to our experience, ultrasound-guided HIFU could be considered as safe and effective approach for treating pancreatic cancer. So in the future, like I think we would like to work together to do some clinical study to confirm the role of HIFU in the treatment of pancreatic cancer. So that's all I want to share with you. And also, I hope see you guys soon in China, in Chongqing. Thank you very much.
Thank you very much. So again, if you stop sharing the screen, or can see if there are any questions, or you can put them in the chats.